Good day, everyone, and thanks for joining us. But before we start with break from the herd or go to the butcher, we want to give you a little gift, okay? And that's this. I understand how much of an obstacle course it is out there right now to get yourself well, less trying to get your family well. So we've created what is called the Quick Start Guide. And all you have to do is just email us at quickstart@docofdetox.com, and that's it. So let's get started. Welcome back, everyone, to Break Free from the Herd. Part 2 is issues, tissues, and tumors. Listen, until we learn the art of honoring, respecting, protecting, and forgiving ourselves first and foremost, our health will always be in jeopardy. Take back your God-given potential to love, health, and happiness. Understand this: all chronic diseases are complex diseases. An unmanaged disease can cause up to 10 to 30 physical blocks in the body. So to focus on one part of the body and not the whole body when dealing with a chronic disease means you are going to deal with this illness or even something worse throughout the rest of your life. The part of the body that we call the disease is just the weakest link in the body breaking down. It's called body talk, a language that most people do not understand because they have never been taught this. You know the saying, the straw that broke the camel's back? Well, this time it's no camel. It's your body's weakest link. The weakest link is not the end-all, be-all of healing, but it can put you in the hospital, nursing home, or cripple you if you do not realize that your body is talking to you and telling you to take personal action and love yourself well. All chronic diseases are just symptoms that have been mismanaged and mistreated. The medical system chases symptoms like a dog chases its tail. They never seem to catch the true cause, do they? How convenient for repeat business. They market this approach so well that most of the natural health industry practices the same protocol. Understand this: disease names are only good for communication, but they mislead and distract you from your true healing because the answer lies in the cause, not the symptoms. Most practitioners do not understand that physical blocks like adhesions, fibroids, and tumors are nutritional energy blocks that will eventually starve you. These physical energy blocks must be gently taken apart and eliminated in a loving way, or they will eventually take you apart by stealing your nutrition and undermining your immune system. Any adhesion, fibroid, or tumor is like a chunk of ice. How do you get rid of a chunk of ice? Well, you raise the temperature and melt it. The first step is using Wolfe Non-Surgical to lovingly pull the fibers apart because these physical blocks have the consistency of beef jerky. As the fibers pull apart, lymph, blood, and energy flow increases along with the temperature in and around the area. This increased flow and temperature dissolves the crystallization and transforms the fibrous scar tissue back to healthy connective tissue, thus restoring the ligaments, tendons, muscles, organs, and joints back to their original healthy state. So let's pull the fibers apart, whether we are talking about arthritis, a knee replacement, hip replacement, spinal surgery, fibroid, adhesion, surgical scar, or tumor. It's all the same. It's issues in your tissues. Let's pull them apart gently and lovingly, raise the temperature, raise the vibration, and then the body will heal itself. Remember, with every physical block created, you will suffer with more pain because you are blocking and disrupting the natural flow of the visible and the invisible. These energy blocks are the disease. An example of this is crystallization, calcification, internal scar tissue, blood clots, cysts, pimples, adhesions, fibroids, tumors, and everything else that creates discomfort within the human body. Never forget, pain is your body's GPS. It's your guardian. It's your friend to the end, so respect it and listen to it. In today's society, pain is a gift or a punishment. It all depends on your belief systems. Do you want to be a physical victim or an awakened spirit? It's as simple as that. Pain is the most accurate diagnosis. Pain is the protector for those who are conscious. Pain is an alert system to get your attention and focus. Where your focus goes, energy flows. Pain is the greatest healer when you learn to master it through self-awareness, self-love, and self-care. The more peaceful the heart and the mind are, the greater the healing. We must learn to mind our own business and stay mindful of our breath. Just know this, you can't have a healing crisis unless you have issues in your tissues. The pain you experience is the pain you must release on an emotional and physical level. It is as simple as that. These are all issues buried deep within your tissues. Remember that the invisible becomes the visible, that the invisible eventually comes the physical. Look it. God created the vehicle called your body, but only you hold the key to turn on self-healing. And this key is called self-care. All healthcare systems that do not empower self-healing have been created to create the illusion of the healing. This is the disease of business, or should I say the business of disease. When you put your faith in mankind, the body takes the back seat or may even become what? Obsolete. Self-healing is the only way. It's nature's way. It's the universal way. We will continue to create emotional blocks within our body until we understand that the true definition of disease is an unconscious, subconscious dislike for oneself programmed into us through society's man-made systems. The more toxins and negative emotions that we take in, the more fat cells, internal scar tissue, adhesions, fibroids, and tumors our bodies are going to produce. What people do not realize is that scar tissue stores more toxins than fat, but tumors store more toxins than scar tissue. You will continually have to detox the visible, otherwise the physical, until you learn the art of detoxifying the invisible. Otherwise, the dysfunctional beliefs that block your emotional potential. You can remove the tumor, but did you remove the belief that gave it life in the first place? We must learn to master the 3 T's, this being toxins, thoughts, and traumas. That brings us to this, stress, the invisible injury that causes almost all disease we suffer from today. Can you believe that even the Heart Association does not even recognize stress as a factor when it comes to heart health? Again, we see Big Pharma playing the puppet master. Look, whether we're talking about the heart or any other part of the body, stress creates more inflammation and internal scar tissue formation in the body than any other diet. The medical system and even the natural health system do not recognize scar tissue until it becomes an adhesion, fibroid, or tumor. Both of these systems do not have what I would call a successful plan of action. Scar tissue is the issue when it comes to your physical well-being. If you do not untie these invisible bonds that bind you on an emotional, physical, and energetic level, your human potential will remain blocked on all levels. When it comes to issues in the tissues, you now have a choice: drugs, surgery, or Wolfe Non-Surgical. It's your choice. Now you actually have a choice. Without gentle, loving destruction of these obstructions or blockages, you won't have healthy construction, or in other words, a true healing. Whether we're talking about performing a Wolfe Non-Surgical heart release, pelvic clearance, breast lift, hip, knee, or spinal restoration, these physical blocks must be removed so that the proper blood, lymph, and energy flow returns to the area of concern. This concern being the tissues, joints, and organs, so that we may restore them back to their original state. If you remove these physical blockages, you increase circulation. If you increase circulation, you increase energy, which then increases temperature, which turns on the built-in mechanism of self-healing. For healing to take place, we must transform the scar tissue back into connective tissue, melt the crystallization, and return the displaced calcium to where it belongs, your bones. One of the biggest hurdles for practitioners, still to this day, is finding a successful method to return the displaced calcium that is in the tissues, organs, and joints back into the bones where it belongs. We are now able to restore this displaced calcium back to the bones with SAC Ionic calcium therapy, one of the biggest nutritional breakthroughs of this century. Listen, this treatment has the ability to return bones back to their healthy state, no matter what the age of the patient client. Go to the Doc of Detox library and click on SAC Ionic Calcium Guide to read our 30-page overview and watch the truth about calcium and the science about SAC calcium, and then call me directly at 855-900-4544, extension 5, for your free consultation on SAC Ionic Calcium Therapy. Never forget, the main reason calcium gets pulled from your bones is to keep your body pH alkaline. Balanced blood calcium is critical. Your body will always give up bone calcium to protect your life. We know that inflammation, internal scar tissue formation, and displaced calcium are the major causes of joint problems, premature aging, autoimmune diseases, physical limitation, and yes, even cancer. No matter what the injury, surgery, disease, or chronic condition you may experience within your body, you must always go in and clean up the excess buildup of internal scar tissue, crystallization, and displaced calcium that occurs during the body's natural healing process. Look, what I'm saying is, due to this overcompensation during the healing process, we must go in with Wolfe Non-Surgical deep tissue therapy and lovingly remove the physical blocks that naturally occur with every accident, injury, disease, condition, disorder, or trauma. To completely restore the joints and tissues, we must remove the invisible blocks that bind us. What I just shared with you is the master key to staying vibrantly healthy throughout your whole life. Yes, we get older, but you don't have to feel old like the majority have been taught. Just know this, your body will always overcompensate with laying down excess scar tissue, crystallization, and calcium to protect any weakened disease, injury, or highly acidic area, and it will do this even more so when it comes to surgery. Nothing creates more scar tissue problems in the body than surgery, so be aware of the invisible bonds that will eventually strangle your tissues, muscles, joints, and organs. Understand, there is a major problem in healthcare today with practitioners not understanding the body's natural healing process of overcompensating with scar tissue and displaced calcium to protect and support the healing process of an injury, diseased, or damaged tissue. Listen, I'm telling you something that people are not aware of, that even the health professionals are not aware of out there. If they were, why is everybody walking around with a limp, a cane, a walker, a wheelchair? Why are they still on drugs if they have been healed? If the scar tissue has been replaced by connective tissue, if the calcium's back in the bones, if the crystallization has been melted, if the inflammation has been put out? Look, where the problem lies is, body workers, therapists, nurses, and even doctors think that after the injury is healed, their job is done. So now, because of the lack of understanding that most health professionals have on this topic of the body overcompensating when healing, the majority of the population is left with physical blocks within their joints, tissues, and organs that were supposedly healed, but later in life will haunt them and eventually even cripple them, as we see with the increase, like I just said, of canes, walkers, wheelchairs, and here comes the nursing home. Look, these physical blocks created by the natural healing process of the body, if not removed, will create stiffness, pain, infection, stagnation, inflammation, internal scar tissue, fibroids, and even tumors, which we continually see in our practice every week. And I mean every week. You can't do better for your patient client until you know better. Just know this, we have been programmed to believe that all of this is normal. It's a normal part of aging. And this, my friend, is why grandpa's stiff as a board and grandma's in a wheelchair, and nobody gives this a second thought. Not even healthcare workers. Now there's a scary thought. If these physical blocks are not removed and the tissues are not restored back to their original healthy state, then blood, lymph, and energy flow will continue to be compromised, along with the quality of your life. During the body's natural healing process, and even after injury, disease or surgery has supposedly healed, practitioners must go in with Wolfe Non-Surgical deep tissue therapy to remove the buildup of the scar tissue, crystallization, and displaced calcium, or the body will never truly be healed, and there will be complications in the future. This one amazing step of utilizing Wolfe Non-Surgical is revolutionizing the way we look at body work and how it's the key to healing. How could something so obvious go unnoticed for so long? I will tell you why. It's called unconscious programming. You would think that practitioners would realize that if their patient client is coming back with the same issue or needing surgery in the same area, then the cause has never been dealt with properly, which is and always will be the issues within their tissues, not their bones. I promise, within your first treatment of Wolfe Non-Surgical, your belief will be restored about the amazing healing powers of your body. Wolfe Non-Surgical deep tissue therapy releases and awakens the supposedly dead nerves that are being strangled, irritated, and inflamed by the internal scar tissue and displaced calcium within your joints, muscles, and spine. Look, the medical system, along with natural health care, are of the opinion that the nerves that are hard to see on an x-ray are dying or dead already. This is false. The fact is, they calcify and they get all wrapped up and choked off with scar tissue, which cuts off the nerve transmission, otherwise the natural energy flow. This same mistake is made by doctors who say there's no cartilage left in the knee or the hip and that it's bone on bone. Well, I can tell you this. The cartilage and the tissue is still there, but it is cemented to the bone, but only until we go in with Wolfe Non-Surgical to restore the joint and the tissue. Because understand something, this tissue has been mummified and calcified with calcium and scar tissue. So it's dehydrated, so it looks like the cartilage, the tissue is no longer there. So remove the calcification, restore the scar tissue back to its original state of healthy connective tissue, and you will automatically restore the flow and the life force to the so-called dead nerves and worn out joints. Even though it is a normal occurrence to see people today limping, furnishing a cane, walker, wheelchair, or scooter, understand this, it is not a normal occurrence for us to see our patients' clients wake up to the fact that after just one Wolfe Non-Surgical deep tissue treatment, along with following the Perfect Day protocol, they finally realize that their body can and will totally heal itself. No one has to remain a victim. You now have a choice for maybe the first time in your life. True health has always been a joint effort between who? You and your body. You must take personal, massive action. Stop attacking with drugs and surgery, and you will heal. All therapies have their place, but unless you open up and transform the internal scar tissue back to healthy connective tissue, eliminate the crystallization, and replace the displaced calcium back to the bones, then the therapy is only temporary at best. Where other therapies fail, Wolfe Non-Surgical deep tissue therapy succeeds. Wolfe Non-Surgical deep tissue therapy is the antidote to needless surgery and the implant-obsessed approach that the world has bought into. Why make surgery your first choice? Why not give your body a chance to heal naturally? God does not create junk, man does. Let's get that perfectly straight. Understand something. We offer all our patients a money-back guarantee that their first treatment will outweigh all other treatments and therapies they have received up until that point. Your body has not forgotten how to heal. Your mind has. Let's now talk about the holy grail of healing, which is your abdomen and pelvis. Let's talk about a healthy person. And I do mean a healthy person, not today's definition of a healthy person. You will find in a truly healthy person that the surfaces of the abdominal and the pelvic organs are slippery and move easily past one another as the person goes about their daily activities pain-free and with energy. For most people, they have quite a different day in store for them because of the inflammatory lifestyle that the majority live. Adhesions, which are bands of scar tissue, will form anywhere and everywhere in the abdominal and pelvic area, restricting and tying this person up in knots. For all of you who are going to surgery, just know this. Surgery causes more adhesions than anything else. But abdominal and pelvic surgeries create more adhesions than any other surgery. For before and after surgery care, please consider reading, watching, or listening to The Perfect Day Guide, Fasting for Perfect Health Guide, and the A to Z Wellness Guide in the docofdetoxlibrary.com, because surgery is no longer your only option. Total elimination of the inflammation and adhesions through a non-inflammatory lifestyle such as the Perfect Day diet, advanced water fasting, and Wolfe Non-Surgical is the most effective way to reverse and prevent the continual formation of adhesions and to prevent further surgery. An adhesion is an internal scar that forms in the body after and all surgeries. Scar tissue adhesions cause tissues and organs to stick together like glue. Understand that external and internal scar tissue and adhesions do not stretch, they pull, they tear easily, they grow roots, and they attach themselves, eventually choking off your organs, tissues, and joints. Adhesions cause chronic constant pain, fibroids, cancer, endometriosis, and infertility. Infertility is becoming an epidemic. This is why we have created a 7-day training called the Perfect Pain-Free Pregnancy Personal Treatment and Training, which, by the way, is one of our most popular trainings for couples wishing to become pregnant or already are. And understand something. With this protocol, couples that can't become pregnant can become pregnant. Understand something. You're not broken. God did not make junk. You have an inflammatory lifestyle that has created scar tissue and depleted your energy. Return the energy, remove the scar tissue issue, and I'll tell you, pregnancy is around the corner. Let's talk about a scar tissue issue that 20% of North American women are afflicted with. This condition is known as endometriosis. Endometriosis is a medical condition that occurs when the lining of the uterus, called the endometrium, grows in other places, such as the fallopian tubes, ovaries, or along the pelvis. So this is where we can find pregnancy to be a complication. When that lining breaks down, like the regular lining in the uterus that produces the menstruation, it has nowhere to go. To this day, the medical system is still claiming ignorance, that they have no idea what causes endometriosis. But my hope is that you are beginning to understand that the top 4 causes of endometriosis are constipation, leaky gut, surgery, and inflammation. This is a scar tissue issue created by misinformation about inflammation. So, what do you think are the 3 top surgeries for North American women? The number 1 surgery performed in North America is the cesarean section. There are over 1.3 million C-sections performed every year. And did you also know some women have 3 or 4 C-sections in a row? And would you also like to know that we have a beautiful woman here right now at our personal treatment and training that is getting a 5-day, non-surgical treatment each day to go in, and we are removing all the scar tissue and the crystallization that was caused by her having 4 C-sections. Do you know the roots? Do you know the scar tissue, the calcium, the crystallization that's in her abdomen, choking off her intestines, stopping her from proper digestion, elimination, having painful periods, painful lovemaking? All of this is going to change, and it is already this week. She's only been here for 2 days. Do you realize the massive amount of internal scar tissue that is created through C-sections? Well, it's debilitating and can even become life-threatening. The second most prominent surgery performed is the hysterectomy, otherwise the removal of a woman's womb, which is her ovaries and uterus. This is also called the pelvic clearance, and in most cases, never needs to happen when a woman takes massive personal action by reclaiming her beautiful body and implementing the perfect pelvic protocol. The third most prominent surgery performed on a woman is myomectomy, or the removal of a benign fibroid or scar tissue mass from her uterus. This surgery is performed due to pain, bleeding, and/or infertility. The main cause of all three of these surgeries is we are a constipation, inflammation nation that is continually being fed misinformation. These three surgeries make up most of the surgeries that women are forced to endure due mainly to a broken system where women are sold off by the pound. Over 33 million women in America suffer from pelvic pain. Why have women accepted this nagging and even excruciating pain as a normal way of life? I'll tell you why. Programming. We are all programmed to serve the needs of corporate America. Look at stabbing pain in your pelvis is not normal. Prolapse, urine leakage is not normal. Painful lovemaking is not normal. Doctors have been programmed for pain. Welcome to the healthcare. Painkillers, muscle relaxants, feeling helpless and depressed have become a way of life for almost half of the female population. Understand, you are not alone. 50% of all the women in North America have pelvic organ prolapse. 1 out of 3 women suffer from sexual pain. The truth is, 49% of all women leak urine. Are we like kidding ourselves? Do you understand on how constipated, inflamed, and how much infection you have to have in your abdominal and pelvic area to be leaking urine, and your doctor can't figure it out? Look, just because this is becoming normal with most women does not make it natural. Do not accept this. You're not broken. You have been betrayed by a healthcare system that does not work for women. It works against women. No matter how desperate you feel, just know that we have turned thousands of women around just like you and worse. Do not give up on you. You do not need surgery. You do not need pills. You do not need to be stitched or have Botox injected into the vaginal wall. Just know you've been set up. You're not broken. The system is. You can take back total control of your abdominal pelvic region when you welcome our perfect pelvic healing protocol into your life. You can finally throw away your panty liners and Depends forever. Never feel out of balance again. We can help you take your power back and keep it for a lifetime. Unleash your feminine power. Within weeks, you will feel and be whole again. End the confusion that your doctor suffers from. When you put yourself first and foremost by honoring, respecting, and protecting your body, you will love yourself well. Awaken and heal your pelvis and get back to life's simple pleasures. To learn more, check out our personal treatment and training guide and the I Am Woman guide in the Doc of Detox library, or go to the International Training Institute of Health.com, otherwise known as ITIOH.com, and unleash the healer from within. The takeaway message that we must never ever forget is that all problems within the body all stem from an inflammation, scar tissue issue situation, right from the tip of your nose to the end of your toes. It is critical that the internal scar tissue created from inflammation, infection, accidents, injuries, sports injuries, and chronically stiff joints be cleaned up and eliminated as the healing takes place. And with surgeries, the excess scar tissue must be eliminated within 8 to 12 weeks post-surgery. It's imperative to take personal action if you wish to set yourself free from these life-threatening invisible bonds that bind you and blind you from the life that you could have. So please understand that these 3 top surgeries, being C-sections, hysterectomy, and myomectomy, are preventable in most cases. These 3 surgeries create life-threatening adhesions in 93% of women who get them. Understand, every woman who has ever had surgery on her abdomen or pelvis suffers from multiple adhesions. This is why the Perfect Day Protocol and the Wolfe Non-Surgical is a must, or these adhesions will continue to grow and create physical blocks that will slow down and eventually cut off circulation, digestion, and elimination of waste, which will lead to more inflammation, scar tissue formation, displaced calcium, and even cellular mutation. When bands of internal scar tissue, known as adhesions, form in the abdomen, they will cause the abdominal organs to stick to each other or to your abdominal wall. These adhesions will even connect the loops of the small and large intestine to each other and choke each other off. They will also attach the intestines to the inner lining of the abdominal wall, peritoneal lining, or with other organs within the abdominal cavity, such as the liver, the gallbladder, uterus, fallopian tubes, ovaries, and urinary bladder. Adhesions in the abdomen and the pelvis always become a web of destruction for all tissues, muscles, organs in this area of the body. Abdominal pain and other symptoms of intestinal obstruction are by far the most common symptoms of adhesions. Laparoscopic lysis is the medical system's way of dealing with abdominal adhesions, but guess what? This surgery creates even more adhesions, which leads to even more abdominal surgeries. The continual growth of these adhesions can cause moderate to severe bowel obstructions by constricting, twisting, or pulling your intestines out of place. These adhesions can partially or completely block food or stool from successfully moving through your intestines. I can tell you firsthand that over the last 40 years of being in practice, that once your bowel movements and urination becomes constricted because of scar tissue and or adhesions, the quality of your life will also be cut off. For those that are suffering with chronic illness, this scar tissue issue is the tipping point of disaster. If you were to ask the tens of thousands of women who have had cesareans, tummy tucks, or the bowel cancer patients who now wish they understood the downside of surgical adhesions and what the upside of gentle daily cleansing, creating the perfect day, and Wolfe Non-Surgical is, what do you think their answer would be today if they were granted full disclosure and if they were given options? You can't tell me that we have freedom of choice in this country when the medical system is the leading cause of death in North America. Welcome to the herd and welcome to the harvest. Adhesions are one of the main reasons why we see bowel cancer rising at such an alarming rate in the female population. Your best line of defense is the Perfect Day diet, gentle daily cleansing, advanced water fasting, the ultimate coffee enema, Wolfe Non-Surgical, abdominal lift, and pelvic restoration to prevent and eliminate the inflammation and the internal scar tissue formation. For more information on scar tissue formation and how to prevent it, go to docofdetoxlibrary.com and watch, read, or listen to Cancer is an Inflammation Scar Tissue Issue and I Am Woman. Look, I have seen so many patients, clients, that when partial or complete obstruction occurs in their bowels, their health declines so fast in such a short period of time. Did you know that you can measure a person's health by their bowel movements and urination? Look, the typical symptoms felt from obstruction are abdominal discomfort around the belly button or the umbilicus. It begins with a cramp, then spastic contractures, and is followed by distension of the abdomen. These symptoms are worsened by eating, and with prolonged obstruction, nausea and vomiting will occur. One of the most powerful but simple techniques you can ever do is called belly button therapy. Check it out at the Doc of Detox, and make sure you also watch the Holy Grail of Healing on YouTube for the most powerful take action abdominal strategies. The most common cause of abdominal adhesions is abdominal surgery. Other causes are abdominal infections such as peritonitis, inflammatory conditions such as appendicitis, colitis, leaky gut, Crohn's, IBS, SIBO, abdominal trauma, radiation, and of course, number uno, constipation. The main cause of the third most prominent surgery performed on North American women is myomectomy, which is caused by the conditions I have just mentioned. A myomectomy is the removal of adhesions or a benign fibroid or scar tissue from the uterus. This surgery occurs due to pain, bleeding, or infertility, which are all chronic health problems that are caused by a healthcare system that does not work for women. It works for surgeons, big pharma, and the implant industry. The main cause of infertility is caused by adhesions involving the fallopian tubes that result in kinking and obstruction of the tubes, thereby preventing the eggs that are released from the ovaries from reaching the uterus. Now, as I stated earlier, I hope you get this, ladies, that you still have the ability to get pregnant, to have a family, because it's a scar tissue issue. How could it be that the main cause for these adhesions being a dysfunctional large intestine is so overlooked, even though it sticks out like a sore thumb in most people? I will tell you why. We've been programmed to disrespect the body, but mainly the holy grail of the immunity, which is your large intestine. Just know that infertility is reversible, but to do this, it is not a medical breakthrough you need. It is creating the perfect day and removing the inflammation and scar tissue that has created the physical block of infertility. Please check out the Personal Treatment and Training Guide in the Doc of Detox library. I think that you are going to be elated. You are going to be empowered, and you're going to want to take personal action. Just know that infertility is reversible, but to do this, it is not a medical breakthrough you need. It's creating the perfect day and removing the inflammation and the scar tissue that has created the physical block of infertility. Please check out the Personal Treatment and Training Guide in the Doc of Detox library, and you will find your answer. And then there are the adhesions and internal scar tissue created by implants such as stents, mesh, rods, pins, plates, screws, and any other device they can invent. Whether it's the hip, knee, spine, breast, or anywhere else in the body, these implants are foreign invaders that are continually giving off toxins, which compromises your immune system 24/7. All implants and surgeries create massive internal scar tissue and adhesions to wall off and protect the body against the implant. The problem is the overcompensation of the internal scar tissue formation, crystallization, and calcification will continue to grow and create a physical block that will actually turn on you and create a domino effect of disease and even more surgery. These blockages, formed by adhesions, attract and store heavy metals, chemicals, toxins, and pathogens because this is a low vibrational tissue prone to disease and eventually cancer, because like attracts like. For those women with breast implants, check out Breast Implant Illness and Healing by Nicole. This is a woman's support group on Facebook. For all women out there, just know this. There has been a major increase in lymphomas due to breast implants and adhesions caused by surgery. Lymphoma is a cancer that begins in the infection-fighting cells of the immune system called lymphocytes. These cells are in the lymph nodes, spleen, thymus, bone marrow, and other parts of the body. There are two types of lymphoma. Non-Hodgkin lymphoma is the most that people get. To be successful in healthcare, we must always search for the root cause of every disease, not focus on the symptoms found downstream. This is the madness found in mainstream healthcare today that feeds big pharma, surgery, and the implant industry. Understand this, that when it comes to breast implants or any other implant, your doctor can hide the scar. But the adhesion is the invisible silent threat that must be dealt with Wolfe Non-Surgical, or it will eventually deal with you. The more you research, you will understand that cancer gets its foothold in and around scars and adhesions due to a choking off of the blood, lymph, and cellular circulation to this area. You will find in the case of fibroids, adhesions, or tumor removal, there is a large reoccurring incidence of cancer because of the scar tissue formation created from the surgery. One should always take action to remove these adhesions in a loving and non-invasive way after every surgery. There is not a surgery that happens that does not leave a scar tissue that does not become an issue in the future, because it always will. Look, go to itioh.com and check out Wolfe Non-Surgical Deep Tissue Therapy and our personal treatment and training. Ask your doctor, how long will it take to heal? What are the signs and symptoms of adhesions forming after surgery? Also ask your doctor what he can do about adhesions, which in most cases is absolutely nothing. History has taught us that we must do our research and homework. Do not trust the professionals. Trust in God. Trust in yourself. Trust in nature. You must take massive personal action to respect, protect, and honor your body, because in healthcare today, your life depends on it. And for God's sakes, get a second opinion. Love your body and you will love your life. How you master your thoughts will be how you live your life. Are you a survivor or thriver, victim or hero? Will you have a reaction or will you take massive personal action? Understand this: cancer is the end stage of low-level love for oneself and constant inflammation. This is why 1 out of every 2 people will experience cancer in their lifetime, as long as they continue to follow the herd. Break free from becoming a statistic. But to do this, you must change parts of your personality if you wish for a new reality. Unconscious living is a killer. Western society does not have true answers for healing. Telling your body to shut up and shut down makes for a dysfunctional relationship. Who wants their pain managed? I want to master mine, because pain is not the enemy. Your dysfunctional beliefs are. The greatest prison ever created is when you become stuck in a world of pain. Just remember, whatever you push, pushes back, and whatever you fight, attacks. Honor the spirit or dishonor the body. It's your choice. Self-love or self-hate. Everything has a frequency. We must rise on all levels to heal. Let's be perfectly clear about this. Your government will never assist non-government regulated health. They are owned and managed by the corporate world. Insanity is believing that the medical system is the definition of healthcare. What you think matters. You can't hold a thought in your hand, but it's still the most powerful thing in the world. We must return to the old ways, not the medical way, not the alternative way, but the traditional way. The old ways, the traditional ways, are the only way because they are true, tested, and proven. You must learn to honor and feed the greatest part of you, your spirit, if you wish to heal. Remember, with every physical block you create, you will suffer with more pain because you are blocking and disrupting the natural flow of the visible and the invisible. Energy blocks create physical blocks, which become the disease. An example of this is crystallization, calcification, internal scar tissue, blood clots, cysts, pimples, adhesions, fibroids, tumors, and everything else that creates discomfort within the human body. So watch out what you bury deep down inside. Never forget, pain is your body's GPS. It's your guardian. It's your friend to the end. So respect it and listen to it. In today's society, pain is a gift that guides you or a punishment that enslaves you. It all depends on your belief systems. Do you want to remain a physical victim or become an awakened spirit? Pain is the most accurate diagnosis on this planet. Pain is the protector for those who are conscious. Pain is a built-in alert system to get your attention that you are unknowingly mismanaging your body. Pain is the greatest healer when you learn to master it through self-love and self-care. Look, where your focus goes, energy flows. The more peaceful the heart and mind, the greater the healing. We must learn to mind our own business and stay mindful of our breath, because our true power is only found in the present moment. The pain you experience is the pain you must release on an emotional and physical level. You can't have a healing crisis unless you have issues in your tissues. God created the vehicle called your body, but only you hold the key to turn on self-healing, and this is called self-care through total self-love. Join me tomorrow for part 3 of surgery, implants, and robots. And remember something, You are beautiful. You are the greatest healing mechanism that's ever been created. So give your body a chance. Give yourself a chance. God bless, and have a beautiful day. And one final reminder to everyone is that on Monday, I will be having my Q&A. So don't miss it at 3 p.m. Pacific Standard Time on Facebook, YouTube, and the Doc of Detox show. And also, just know this, that we are all booked up, okay, for our April certification courses in Kelowna, but we have another course coming in July where we will have the Whole Life Coach certification and the Wolfe Non-Surgical certification. Go to itioh.com and check out the power of healing. Have a beautiful day. Thank you for joining us, and I hope you enjoyed the show. Look, we understand what it's like out there. It's an obstacle course, just trying to get yourself well and then trying to get your family well. So what we've done is we've created what is called a quick start guide. And all you have to do is email us at quickstart@docofdetox.com. And we won't just get you started. We will show you gentle, baby, loving steps on how you can put this all together so that you can create a legacy of health for not just your family, but for yourself. If you're looking for life-saving and life-changing information, well, you've come to the right place. Don't forget to click and subscribe. Stay connected.